Gynecological cancer can come in many forms. We took our cameras to Florida Gynecologic Oncology in Fort Myers to investigate the issue. We began with asking Dr. Jimmy Orr about the advantages of seeing a subspecialist.
Gynecologic oncologists are physicians who are dedicated to the care of women with reproductive tract cancer. All of us have completed our residency in obstetrics and gynecology, and all of us have taken a fellowship so that we understand the innuendos of the importance of surgery, radiation, and chemotherapy. That is, those are the three tools we have to treat cancer. So we can take some of those aspects and sometimes you have to twist them to the left, sometimes you have to twist them to the right. But if one looks at the science and says, well, what does a gynecologic oncologist bring to the table in women who have reproductive tract malignancy and specifically uterine cancer, what we find is they are more likely to be appropriately staged, they're more likely to have had a minimally invasive surgical procedure, and they're less likely to require additional treatments. That is, no longer do women have to be subjected to the potential side effects of chemotherapy or radiation therapy unless there's a real potential need for it. So what the gynecologic oncologist really brings is the expertise to use the tools to offer women the best opportunity for cure, receiving the least treatment and with the least risk.
Dr. Edward Grendys talked with us about the survival rate.
We have seen, number one, dramatic improvements in survivors, in the length of survivors, and how long people live with the disease. In many cases, we actually are now treating this somewhat as a chronic disease rather than a fatal disease. Commonly, we have multiple strategies for chemotherapy that allow us to induce remissions and significantly prolong how long someone lives, more importantly, with an excellent quality of life. When I first started in the early to mid 80s, the overall 5-year rate of survivors was about 10%. We have pushed that up to the neighborhood of about 50% in the right population when the appropriate surgery was done by the appropriate trained subspecialist who does the ultimate operation. So this actually represents probably the most dramatic increased rate of long-term survivors of any solid tumor that we're dealing with throughout the entire human system.
Dr. Fadi Abu Shahin told us about the advantages of minimally invasive surgery.
In our practice, we perform a lot of gynecologic surgeries using laparoscopy, which is using small incisions instead of the large incisions used in the past to access the inside of the abdomen using cameras and special instruments. And this allows patients to recover faster from their surgery and have less pain and less risk of infections. Robotic surgery allows the surgeon to perform more complicated surgeries with less difficulty. In addition to robotic surgery, most recently we've been using single incision laparoscopy, which is a new tool that offers access to the abdomen to perform surgery through only one incision in the belly button. The scar for that incision usually is not visible after surgery. Recovery is faster and pain is significantly less.